Hello all, welcome to my channel Physio Guide by Divya. In this video, we will see a tendon injury patient came for physiotherapy treatment. So after injury, he came after 3 weeks, 4 weeks of injury, he came for physiotherapy treatment. Then this is the progress from 0 to 3 weeks of physiotherapy treatment. This is now he is able to fold all the fingers. First when he came to physiotherapy treatment, he is unable to do, fold flex any of the fingers. So now he is able to flex all the fingers except the middle finger only. He is unable to flex completely. So this is the improvement from the first day of the physiotherapy treatment to the third week, 3 weeks of physiotherapy treatment. Firstly, I have done the manual treatment with the patient by using my hand. I'm doing manual treatment up to his pain limit movement only. Then after manual treatment, I used to keep ultrasound or TENS machine so that the pain get decreased. Here I am doing the wrist movements, wrist flexion, and all movements, all sides, wrist flexion, palmar side, dorsal side, and side inversion, eversion side, every side I am doing with manually only wrist movements. I have told the exercises only from first day only. I have told the exercises what are all to do. In end of the video I'll explain them. Now in manually what I'm doing, I'm showing first of all. Next I'm checking for any trigger point. If there is a trigger point that resist, so I'm releasing them. Next after releasing the trigger point, see I'm doing the finger flexion movements, metacarpophalangeal joint, flexion of metacarpophalangeal joint of index finger, and the middle finger is mainly affected. So this index finger also is unable to do flexion completely and he is feeling pain. Now after metacarpophalangeal joint, I am doing separately this proximal interphalangeal joint also. I am flexing to the end range, to the pain limit of the patient. Next DIP also, distal interphalangeal joint phalanges also I am flexing of this index finger. Next the middle finger, this is the mainly injured, so I'm flexing the metacarpophalangeal joint of the middle finger. Next separately I'm flexing the proximal interphalangeal joint. This is everything I'm doing for 10 times, and 5 seconds I'm holding it for 5 seconds, and 10 repetitions I'm doing. See, I'm flexing the proximal interphalangeal joint and distal interphalangeal joint. How this injury happened means a 52 years old male presented with self-inflicted traumatic laceration of right hand due to mishandling of the grinder mixer, and there is complete rupture of the tendon noted, tendon repair and vascular repair done in OT under nerve block. After individually flexing of this index finger and the middle finger, now I'm completely flexing this all the fingers of the metacarpophalangeal joint, proximal interphalangeal joint and distal interphalangeal joint completely with pressure. This also I'm doing same as 5 seconds hold, applying pressure and then release. So this also I'm doing this for 5 times. After this, with the resistance, with minimal resistance, starting with minimal resistance, then to maximal resistance, I'm applying pressure on each finger. So the firstly I'm applying pressure on the index finger with minimal resistance. Starting I used to give resistance with the only one finger. Now I'm doing resistance with the two fingers of front side and back side, both sides I'm giving resistance. And the abduction adduction movements also I'm giving with the minimal resistance. I'm saying the patient to do movement. Now in middle finger also same as a flexion, extension, abduction, adduction, every side I'm giving pressure with minimal resistance, and I'm saying the patient to do the movement with this resistance. Okay. After that, completely I am giving pressure on this index finger, middle finger, ring finger and the little finger. Completely I am giving pressure and I am asking the patient to open, try to extend the fingers. Okay, so he's trying to extend all the fingers. Starting I used to give pressure on each finger, but now basically I'm concentrating on these two fingers only, index finger and the middle finger, because those fingers only need to be improved and we need to get more strength. Now I'm applying pressure and giving supination pronation movement also with the resistance. See, these are the exercise what I told the patient to do at home with ball or with any dumbbell also, with minimal resistance. Starting one with flexion, extension, abduction, adduction. Now I'm turning my finger sideways and inversion eversion movement, up down movement. Next, see here, round clockwise movements and anti-clockwise movements here. And this smiley ball or gel ball also you can take. This pressing this smiley ball of each finger separately or with with four fingers and thumb separately pressing. And now completely I'm pressing with palm inside the ball. Okay, now I'm closing and opening the fingers widely, wide open and wide close. So this is the basic exercises, wrist movement exercises. There are a lot more exercises with TheraBand, with dumbbells. Not only wrist movements, elbow movements, shoulder movements need to be taught to the patient and need to be strengthened. So I hope you understood this video. Thank you.